Over the past few months, the COVID-19 pandemic has swept across the globe, with cases being reported in nearly every country. While the virus has disrupted the daily lives of many living in the United States, Europe, China, and other developed areas, it's possible the most severe impacts of the virus have yet to be seen. The thousands that have died of cholera in Yemen or Ebola in the DRC demonstrate the challenges of controlling infectious disease in complex humanitarian settings. Due to displacement, crowded housing, malnutrition, and inadequate water, sanitation, and hygiene tools, populations in crisis are particularly susceptible to the spread of COVID-19. For this special episode of Field Perspectives, we interviewed Dr. Michelle Nishrenko to help us better understand what coronavirus means for humanitarian practitioners working in affected communities.
I'm Dr. Michelle Nishrenko. I'm an emergency medicine physician at Boston Children's Hospital, and I also direct the Global Health Program at Children's Hospital and the Children in Crisis Program for the Harvard Humanitarian Initiative.
She also played a pivotal role in helping the Liberian health system respond to the 2014 Ebola outbreak. Like Ebola, the novel coronavirus is highly infectious and strains health systems. Even highly developed nations are often struggling to deal with the influx of coronavirus patients and to control outbreaks. The virus presents an even greater threat to populations in crisis, where poor governance, public distrust, political violence, lack of infrastructure, and weaker health systems could inhibit a comprehensive response.
The populations that are most at risk for spread of disease are those that are densely populated or a lot of transit. And so this includes refugee camps, host communities where a refugee or IDP population has integrated into a community, making it more densely populated, urban slums or cities, as well as then groups in transit if they're moving very closely together for security reasons. With dense population, you get easier disease spread, either by contact and touching for touching diseases like cholera, or through respiratory spread when there's poor ventilation, a lot of people coughing on each other. We often think of this as measles outbreaks or more chronic outbreaks like tuberculosis and spread of airborne diseases.
Airborne is a common way of referring to viral transmission, but coronavirus actually spreads through respiratory droplets. According to the World Health Organization, the disease can spread from person to person through small droplets emitted from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces, then touching their eyes, nose, or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. Unlike Ebola, cholera, and measles, there is no evidence-based cure or vaccine for COVID-19. The only measures we can adopt to mitigate its impact on populations are preventive behaviors such as social distancing and hand washing. But in many humanitarian contexts, adopting these behaviors means making tough choices.
In countries and contexts where there's water limitations, families and individuals are making dangerous choices every day of how much water they consume for their personal hydration needs versus cooking so that they have access to food and nutrition. And then secondary things like sanitation, so bathing, cleaning, hand washing. And so it becomes a prioritized list of what an individual or a family can do with the water supply they have. And I think given the choice of drinking water or hand washing, drinking water is survival, hand washing becomes optional.
Even in these tough situations, it is important to work with communities and enable them to engage in preventative practices. Encouraging people to wash their hands, cover their mouths with their elbows while coughing, or maintain social distance are solid pieces of advice to give individuals. Implementing social distancing with regular programming can be achieved through spacing out cues or separating people in waiting areas. On top of all of this, it is important to continually screen those moving through services and programs to ensure infected individuals are isolated. For more resources about the COVID-19 epidemic in humanitarian contexts, please visit buildingabetterresponse.org.